Hey, this is Dr. Brian Christine, and I know that you're considering having surgical treatment for your persistent post-prostatectomy stress urinary incontinence. I tell you, men who have persistent urinary leakage after radical prostatectomy are really unhappy. And I know it's been tough on you and tough on your family. The good news is there are things we can do. Now, we're going to do a certain workup on you testing, and you've probably already gone through that testing, and we're going to talk in detail about what your options are. The treatment of urinary incontinence after radical prostatectomy is surgical. And there are two different surgical procedures that are available. They're both highly effective in the right patient. The reason you've undergone the testing that you've undergone or will undergo is to help me decide which surgical option is going to give you the best potential for dryness. It's going to be different from man to man, so I tailor the surgery, tailor my surgical recommendation to your specific situation. For men who have a more mild to moderate degree of incontinence and who have not had radiation treatment after their radical prostatectomy, then we typically recommend a male sling procedure. This is an outpatient procedure that takes me about 30 to 40 minutes to do. I make a small incision on the perineum. That's that area between the legs and under the scrotum. I also make a very, very small incision in each groin crease. Through these incisions, I put in the sling, and the sling is a piece of mesh similar to the mesh that I had for a hernia repair, and that mesh is like a hammock. It supports the urethra. We believe that there are men who still have good function of their external sphincter. That's the muscular control valve that keeps us from leaking. And we believe in these men, they simply need a little support from the sling to work toward getting them dry. As I said, that surgery takes under an hour. It is an outpatient surgery. You'll leave the hospital the day of surgery. You will have a catheter in your bladder for 24 to 36 hours. You'll go home with a prescription for pain medicine and a prescription for antibiotics. Now, it's very important in the first couple weeks after that surgery to not do heavy lifting and heavy exertion. So, for 2 to 3 weeks after the male sling surgery, I don't want you to lift anything heavier than a gallon of milk, a 5-pound weight limit. No sexual intercourse, no deep knee bends or deep squatting. We do all that because we want the sling to heal in a good position to give you the support that your urethra needs. I'll see you back after the sling surgery in a few weeks, and my secretary will set that up. But between the time of the surgery and the time that I see you back, we want you to take it easy, and we'll talk more about that. For men who have a very severe degree of urinary incontinence, or men who have had radiation treatment after their radical prostatectomy, I recommend an artificial urinary sphincter. An artificial urinary sphincter is an implantable device to treat male urinary incontinence. Artificial sphincters have been around for over 40 years. They're very safe and they're very effective in the right patient. Similar to the male sling with the artificial sphincter, it's outpatient surgery. You go home the day of surgery. It certainly takes me less than an hour. I make the incision in the perineum down between the legs. But with the artificial sphincter, I also make a very small incision in the lower abdomen. The artificial sphincter has a synthetic cuff that goes around the urethra to squeeze the urethra, and that's what keeps you from leaking. There's also a small pump shaped almost exactly like the end of your pinky, and that pump is in the scrotum, under the skin. And the way the device works is, when you have the urge to urinate, and you'll get the normal urges to urinate, you go into the bathroom, you unzip, you stand or you sit, whatever you like. You can feel the pump under the skin of the scrotum. You push on the pump, and that causes that synthetic cuff to open, and you can void. When you're done voiding, you zip up and go on your way because the device automatically resets itself. So the artificial sphincter, you have to manipulate that pump, push that pump to urinate. With the sling, there's no pump, there's no mechanical component. You just urinate. Either of those surgeries have a very low risk of infection. For the sling, the risk is probably less than 1%. For the artificial sphincter, about 2% risk of infection. Both very low. With either surgery, you do get antibiotics at the time of surgery and afterwards. And of course, with either surgery, you do get pain medicine after surgery. And in this day and age, as we're trying to limit the use of narcotics by patients, you'll have a small prescription for narcotic pain medicine, but you'll also have prescription for anti-inflammatories as well. With the artificial sphincter, just like the male sling, I want you to take it really easy the first couple weeks after surgery. The artificial sphincter and the male sling provide great treatment options for the man who has urinary incontinence after prostate cancer that never gets better. I can tell you that as a prosthetic urologist, my happiest patients are those men who have incontinence that we treat either with a sling or a sphincter, and their incontinence either stops or gets much better. Those are probably the happiest patients I take care of, because urinary incontinence really is a big deal. We'll talk more about these things. Thank you for watching the video.